Well, hello.
Hey, Shar. Hi, everyone.
How are you? It's been a hot minute.
Oh, we had a lot going on.
We did.
Thank you guys for everybody that came to the
Mhm.
Beauty Bash and came online and checked it out.
Yeah.
We appreciate you all.
We really do. We feel like we are on camera a lot
Yeah.
for a little bit of time, but
Yes.
we haven't done one of these episodes for a while.
Hot
So,
minute.
yeah. So, welcome to the MMAC Minute.
Yes.
We think episode 4.
4. Pretty sure. It's
Yeah,
4.
we'll check. Anyway, so we have a treatment. We've just got a few things to talk about today, just kind of highlight. And one of them is a treatment that we call ClearLift. And it's a lot of people are bothered by recurring brown pigment in their skin and a little bit of laxity.
Mm-hmm.
And traditionally, and we still do, there's a couple treatments that we really do. BBL treatment, which is broadband light.
Mm-hmm.
We do some microneedling that can lift pigment, but they both have a little bit of BBL can be uncomfortable, and to the point where some people just don't want to do it and will avoid doing it even though they don't like their pigment. Broadband light is still the most broad spectrum as far as improving skin laxity, red, broken capillaries, and generalized redness, and brown pigment.
Mm-hmm.
But we have options. We have
options.
a great option for people who are really uncomfortable doing BBL treatments, and it's just something that they will avoid being treated because they're just not comfortable with it.
Sure.
So we have a treatment called ClearLift, and it uses a technology called photoacoustics.
Mm-hmm.
And it is a way of
What is photoacoustics?
photoacoustics. It is a way of causing micro injuries at different levels in the skin without heat. So it really is comfortable. Oh, nice.
Okay, carry on. I just realized that I ate something and then I needed to have a little gum before we
Which
were
is great
this close.
since she's sitting this close to me.
It's for
Oh
you.
my God, that's hilarious. You're lucky it didn't fall out.
I thought I was just going. Okay, now I got to put this somewhere.
God, that's hilarious. Anyway, photoacoustics causes micro injuries. We can use it for the deepest layer, which is going to really improve skin laxity, and then every layer in between to the most superficial where a lot of the pigment lies.
Yes.
And truly, I had somebody yesterday who she just is BBL adverse because she just doesn't want to put up with any swelling or the flashes of light. Everything just isn't comfortable enough.
A little too intense for her.
Yeah. And so she was just like, do you promise me? Do you promise me there's no pain? I said, I promise.
It is so comfortable.
And so we did 2 different levels on her. And she did I didn't do the most superficial. I did the one right below that and then the middle layer. And the middle one, she's like, yes, 0 pain.
We can
and
feel
then
nothing.
The other one, she ranked a 3 out of 10.
Yeah.
So
I think that's reasonable.
that's reasonable.
Very. I have had people fall asleep doing that treatment before.
Yeah,
so if that tells you
nice.
anything. Mm-hmm.
There's no gel, nothing like that. It's really easy. To do.
Quick.
In your day without any needing to worry about gel getting in your hair and needing to fix your hair or anything like that. Being swollen and red afterwards. It just really doesn't happen.
No. And you can wear makeup right after if you needed to. No big deal.
And you don't peel or anything.
No.
The changes will be more subtle than a BBL. That's the trade-off.
True.
You don't have that activation of pigment that you get, the coffee grounding and that kind of thing. So it just slowly fades.
Gradual fade.
Yeah. So sometimes people equate a success with having a few days of downtime of some way.
Like you can see something was done.
Yeah,
when you
something was happening.
Yeah.
And with the ClearLift, you don't have that. It's just more trust the process type
and
thing.
You can kind of feel like your skin feels a little plumper after.
It really does.
Yeah. It's not like a drastic, like I'm going to be red and swollen and you have the coffee ground. Like
that you have to worry about covering up with, makeup or trying to. So it just kind of gradually fades, which means you may need more ClearLift treatments than you would a BBL. But again, you're not going to have any downtime.
It takes less planning.
Less planning. Yeah. Less proactive planning with it. It really it can be one of those things that you just kind
pop in and do.
this is true for BBL if you're only doing BBL for pigment, and it's true with ClearLift that you can, your treatments can be spaced 3 weeks apart. So that is when, with consistency, is when you see really the pigment begin to fade. And the other benefit is you always get some skin tightening with it.
Yeah.
We typically do 2 layers with any one treatment.
Mm-hmm.
We can vary that a little bit if somebody is pretty densely, affected by pigment. We might just do all pigment one time, but it can change with every treatment.
True.
Another thing we use the ClearLift for is a little bit of treatment of lips. Yes. It's a series of 6 treatments. They take 15 minutes is all or so less quick. Each treatment helps with those perioral lines above and below the lip, and just the lip plumpness itself, because again, those micro injuries cause that tissue to kind of repair itself and be activated. Yes. And some people just don't feel that a dermal filler of any consistency is for them. Sometimes, neurotoxin can help those lines, but that has its own issues.
We have options.
Yeah. And so ClearLift with the lips is really nice.
And the little dry skin that you get during this time of year as it changes the seasons, and it's like, I cannot keep my lips from drying out so fast. I cannot drink enough water. I keep, ointment on my lips or something, but it dries them out. This helps, resurfacing. One
of the most exciting things that this ClearLift is used for is treatment of melasma. And really up until now, we have not had a really good predictable treatment for melasma. Yeah. We really shy away from using broadband light or any heat device with melasma.
Don't want to make
melasma
it worse.
Can be so sensitive and activated. Melasma, if anybody doesn't know, is a hormonally driven brown patchy darkness. And melasma has very signature areas: forehead, around the eyes, cheeks, chin, upper lip. And the thing that we know about melasma, there's a couple things. We know that melasma always has a twin. So if you have a patch, if it's melasma, you have a patch here, you'll have a patch here, here, sides, or underneath your eyes. They won't be identical twins,
just gonna say
but they will be twins. Yeah. And that melasma, you don't even need to have direct sun exposure to activate melasma.
Nope.
People who have really sensitive active melasma can activate that melasma just from a heavy workout. I had a gal in today, and she talks about her forehead, and she said, this is going to sound really weird, but she said, I always wear a cowboy hat when I'm at the ranch. Always. She said, I never am without one. It just helps my face. It keeps me cooler. She said, but I notice when I take that cowboy hat off and it's not had any sun, is I have brown, she just called it modeling here. And that's kind of
looks like that.
It does.
Lacy or modeling.
Yeah. And I'm just like, and when we first started talking, I was like, I wonder if she's got melasma. And then the more she described it, I'm like, that's it. So we talked about the ClearLift with her because and you will do typically a series of 8 treatments for melasma. That's kind of our package, accompanied by one of the brightening creams, either the hydroquinone free one or the one with hydroquinone. And that's another conversation we can have.
Hold on a second. I got to show you guys a picture of what that can look like. I've got such a great before and after that she has very generously agreed to let us show. So I'm going to put that up real quick and just tell you that this is halfway through her series of 8. And we already saw such great results. She was very consistent about using her prescription, and she
regularly scheduled and showed up for those treatments.
It's pretty amazing.
And she was really frustrated, right? I mean,
she'd been dealing with it for years.
And it can really kind of devastating for people.
It's a bummer. Yeah. It's a bummer. She did great, and it turned out amazing.
Unbelievable. But melasma is something that is actively managed. It has to be actively managed. We talk about melasma being a skin disease.
Yeah.
Because
there's no cure. It's just treatment.
She will continue to need treatment of some sort. She may be able to, when she's all done, manage with topicals, but every once in a while have to throw something in. Like I said, a heavy workout can activate melasma. You could be as careful as possible, hat on, under an umbrella, sitting in the shade.
That was me in Hawaii.
On a hot day.
That's how mine happened. I was fairly newly pregnant, and I'm like, okay, I'm going on vacation to Maui. It's been a long winter here. I went in April, and it was snowing right before we left. So I go and I'm like, wide brim hat, wearing SPF, sitting in the shade. And I go in to get ready for dinner, and I'm like, what is that? Why do I have dirt? Oh, it's
Not
on
dirt.
both sides. Yeah, it was
Yeah.
not dirt. It was melasma. And I swear to you, that skin like did not see the sun. It was just, it got hot.
Yeah.
Yeah.
So saunas can activate melasma. Anyway, up until now, we really have had nothing. We can do some skin peels that help a little bit on a superficial level, but this ClearLift has been a game changer for melasma.
It's awesome.
Yeah. So I'm just going to grab my notes here.
By the
see
way,
if I missed anything.
This is not really a script because I get here this morning and I'm like, Sharp. She goes, yesterday, are we doing the podcast? Yeah, we have time blocked out. Okay, what do you want to talk about? I don't know. We'll figure it out. We get here this morning. What do you want to talk about?
I thought about that on the way here.
Sounds good.
Yeah. So which is cool because this is something this is the way we talk.
Just a conversation.
Yeah. A couple things about pigment. And pigment is one of the things that can change our entire life. It can be different our entire life. And what we do know about it is, for most of us, by the time we were 21 years old, we have had enough sun exposure to open our own pigment factory. And that factory is going to be open for the rest of our lives. And a factory's job is to put out pigment or put out product.
That's a good visual.
And this one puts out pigment. And most people will notice it starting at about mid to late 30s and then becoming progressively worse and needing more and more active management depending on the amount of sun exposure and damage has been done. But we kind of have to change, in my opinion, our thinking on that, because our skin is kind of really smart. And our skin will throw up melanocytes as a protective mechanism, because as we get older, our skin, as our largest organ, becomes more and more tired and has to fight more and more. We typically really only see atypical atypical skin lesions or precancerous lesions on aging skin. It's not a thing of young skin, right?
Yeah, more common.
So those melanocytes actually are protecting our skin. So when we do treatments to help improve those, we actually are causing the production of healthy skin cells that will protect us from unhealthy lesions and manage the pigment. So our skin is just a really smart organ. So we can't get mad at it for throwing up those melanocytes because it is trying to protect us.
You can get mad, but
don't we can actively manage it.
You're allowed, but
one other thing to say about the ClearLift is it is really a fun thing. It's considered, you can use it in a whole different lots of different ways. Just for plumping the skin, it can be a laser facial, it can improve browns, it can improve skin laxity. We have 5 different levels that we can work with. And one of the things that is really fun is if somebody has a big event coming up, a wedding, even family pictures, family reunion, anything, and you just want your skin to feel and look really plump, it is amazing what this treatment 2 weeks before an event can just plump up your skin and make it look hydrated and healthy and kind of glowy. It's
get rid of any dullness.
And again, without any kind of downtime. There's not going to be any flaking, any peeling, any.
One thing I will say that we can notice sometimes is petechiae. So if you've ever seen that little pinpoint bruising, just little teeny tiny reddish purplish dots, most commonly around the mouth, the eyes, or the jawline there, it's really faint and it may last 2-3 days and you can cover it up with makeup. But if you get it at all, that's, and
usually that's going to be on the most more superficial.
Yes.
Tips
so we can avoid that or minimize
at the pigment resolution.
Right.
Yeah.
Right.
Boy, I think that was kind of fast and furious, but got everything maybe?
Yeah, I think that was a good rundown for that.
Well, how else can we use this same laser device?
Do we want to talk about that, or do we want to save that for a whole nother one?
That's a good one. I thought this was going to be quick, and it's already 15 minutes.
That's how things go when you don't have a script.
Yeah.
Okay, so since it's the MMAC Minute and not the MMAC Hour, we will talk another time about tattoo removal. So we'll do a little teaser there.
Yeah.
So I guess that leads us into, so that was all about our ClearLift laser and our pigment perfection therapy. Amazing. I
did all the talking.
You did. That's okay. I was here for moral support.
Okay, thank you. Thank you.
Yes. Mm-hmm. Oh, good point. See how good I am at this, you guys.
It was really good.
Okay. Anyway,
okay.
Let's talk about our week's obsessions.
Okay. I've said this before, but I love this image.
You did say that before.
I know. I'm going to try to get that up here. This image primer. It is a really, it's like a whipped kind of sunscreen. It's a very, very light pigment that just kind of mattifies like redness and evens out skin tone. It's a 50 SPF, and you put it on very lightly under makeup, and primer's job is to cause skin cells to swell. So it minimizes the appearance of pores and fine lines, and then any kind of foundation goes on much more smoothly. I find that I use a very, very small amount of any kind of foundation over top of this. You just don't need it. On the weekends or when I'm not coming to work or anything or going anywhere, I use only this.
Yeah.
That's
good stuff.
I love it. It feels light. I am not a lover of dense, thick, heavy sunscreens. Yeah. I just don't. I don't like them. And so for me, this is a sunscreen that I will use, and I do use it every day. And it has other purposes too, and I love it.
Yeah, good stuff. So nice. She said it twice.
Yes. And then again, our Renew and Rescue.
You guys.
And this is our ceramide lipid.
This is a new one.
Repair serum. And lipids are fats and oils. And most of us here can be both oil and water deficient, especially, I mean, we live in the mountain desert. And so, and then on top of that, it's dry in the winter. And, this is amazing. This feels so like good. Silk.
Oh, you got to try it.
Oh, I after I wash my face, this goes on first.
Yeah. Try it. And then next time you're in, you just got to feel it. You have
just
to.
Ask to try it.
Yes.
It is amazing. And this bottle lasts a long
time.
It
does. Yeah. It really does. I was impressed.
Surprised.
Yeah. It goes a long way. It's good stuff.
So those are mine.
Okay. Well, that's funny because I picked two also. These are some tried and true ones that we've had for a while and have great success with. So one is I'm going to need your support here. Put those down. You got to help me. Oh, yes, there we go. This is our MMAC. Can you even see it? Yeah, okay. Hyaluronic quenching serum. So this is, speaking of that dry weather, we all need hyaluronic acid. We have hyaluronic acid. It's made in our bodies. It holds on to moisture. So when we have like dermal fillers, they are hyaluronic acid based because it's going to grab moisture and plump up a little bit. We want that under our skin. We want that for our skin as well. So that will help hold on to some moisture in our skin. Now that's going to bring the moisture, but then I like something to help lock it in, especially during this winter. So this comes in, our Face Fix. This is a nice, thick but not heavy moisturizer. Right. Oh, it's so like locking that moisture. Yep. So this goes on towards the end for me. I use it twice a day. Use it however you like.
I use that and I mix my hyaluronic acid in it. I mix the two together.
Interesting.
My philosophy on moisturizers and what I believe from what I've read to be true is a moisturizer can only be effective if it actually absorbs.
Yes.
Because if it doesn't absorb and it just lays on the surface of the skin, all it's really doing is holding in any of your own natural moisture.
Which if you don't have enough,
right. It's not, but if it can't cross that barrier, it's not doing anything.
Yep.
So this one is really super healing. It has copper in it. It also has some hyaluronic acid, but I add more with the filler, the hyaluronic filler. So
never heard anybody to have a little bit more hyaluronic. No, so the way you can try this one next time you come in too. Do one on one side, one on the other hand. I put the hyaluronic acid and let that soak in a little bit. It's crazy. You put it on and it's like it spreads so nicely and so far that you don't need that much of it. And then let that absorb a little bit, put the Face Fix on over it or both together. But it's like when people try that out, it's like, oh yeah, because if you put like an ointment or something on your skin, if you've ever tried that and your skin is dry, it doesn't make your skin any less dry. Now you just have greasy hands. So you got to get some moisture
like
in there.
Petroleum, like petroleum jelly. It is a great barrier. So like a diaper area or something that you don't want moisture to get to, you put that on and it protects from moisture, but it doesn't soak in.
Right.
It rubs off, but it doesn't soak in.
Yes.
Yeah.
Yeah. So anyway, so what's your personal one?
I'm just going to shout out Jenna. She's our front desk gal, and she's just
the best front desk gal.
Yeah. She greets everybody with the nicest little smile, and she remembers your name, and she never gets flustered or frustrated. And
she's as cool as a cucumber.
Yeah, she does. She just never, nothing. She just bounces with whatever happens. She's and keeps us running smoothly.
Thank you, Jenna. And she has to listen to these up front over and over and over again. So now she's going to hear her name and go, they're talking about me.
Oh, yeah.
Nice.
Didn't think of that.
I know. So mine's going to get a little personal and a little maybe woo-woo. Are you ready? I'm throwing a curveball out of here. So mine is therapy. We talked about like self-care, and that's important, especially around the holidays. But for women, I feel like we tend to put everybody else first. Anybody else ever experienced that? Kids, husband, family, work, everything, house, vacuuming, cooking, cleaning, everything on the list. And you're like way down here at the bottom. And that's not good for us. We've got to take care of ourselves too. Otherwise, all those things are just going to wear you down until you can't manage those anymore. So I think therapy is very helpful. Maybe you don't need to go every day for the rest of your life, but I found that there are times in my life that it's been more helpful than others. So I was talking to a client this morning, and it really solidified that I felt we should talk about it and normalize it. Who cares? Everybody can go to therapy. Right. You can talk about it or don't. But I think it's normal and it's good and it's healthy. And I went to my therapist the other day, and we just had this breakthrough. And as we're talking, she goes, we did like a cool therapy EMDR. I don't know if you've ever heard of it. But we're talking, and we do the EMDR, and she goes, okay, tell me what happened when we did that. And I'm talking to her about my process and what I felt in my body and where and all this stuff and how it helps me process through things. And she goes, I heard you start breathing like really deeply. And I said, yeah, I do that when I meditate. And it just like started happening. And I instantly felt my shoulders lighter and I could sit up taller. And I didn't notice that I always hunch. I have bad posture. And it was like, oh, now I don't feel like I'm walking around with a sack of rocks on my back. I feel like I'm being pulled up by a string from the top of my head. Like it's just a weight lifted off. So that was kind of nice. And
okay, so I'm going to interrupt you really quickly. Go ahead. But so, and I think part of it is just identifying what your triggers are.
Yeah.
Right.
Yeah.
And so she doesn't even know I'm going to say this. But she was trying to make a phone call today, and it was to a pharmacy, which can be really frustrating.
I hate that.
And it just wasn't
some pharmacies.
Yes. And it wasn't, it was just frustrating.
Yeah.
It wasn't,
I didn't have a lot of time. And it wasn't working well.
And finally she just looked, she goes, okay, I'm getting mad
because it's
close to lunch.
I'm hungry.
I know this. Nothing good can come out of it if I continue here.
I'm just going to walk away.
I'm going to walk away.
I did.
And she did.
It was before I got mad, so it was like, if I continue down this road, I will get upset, and I don't need that in my life.
Yeah,
that's funny. That did just happen.
I had one of those days on Tuesday where I was just like, if I don't check myself, it will snowball. I just said to Marisa, I said, listen, if I say something today that is really mean, I don't mean it because.
Yeah. But you know what? That's good. And if you're in a place where that is like your reality, where you're constantly overstimulated, overworked, overtired, overhungry, it's hard to
a day here or there is normal and stuff. But if
you let it pile on, that changes your mood, which over time changes your personality, and that's who you are. So that's not what I want to convey all the time. So I'm checking that.
But it was really funny.
Thank you for noticing.
I don't mean it.
So. All right. Well, I think that's a good place to wrap it up. Thank you guys for tuning in. And please remember to like this video, to subscribe to our channel, and share. And
please comment below. Anything, just I watch.
Tell us your thing too about what your obsession is or what helps you get through these crazy holidays or something. We'd love to hear those.
Yep. All right.
Thank you guys so much. Take care.